Okay, everyone ready? As my dad used to say, they were born ready, this group back here. So good morning, everyone. I'm State Representative Cristin McCarthy Vahey. I have the privilege of co-chairing the Public Health Committee alongside Senator and Dr. Saud Anwar, who regrettably is not able to be here with us today because he is treating patients this morning. And I want to begin actually by acknowledging and thanking Senator Anwar because it was through his work, his reading, his understanding, his talking with some of the people who you're going to hear from later today, who really championed this and brought this bill forward. In 2024, the Public Health Committee created a working group to address what we called non-alcoholic fatty liver disease, which I know now has another name, which I'll say in just a moment. And I had the privilege of joining that working group that was led by Dr. Mahal and Dr. Benini, who are here with us and who we will hear from later today. They did an amazing job bringing together a group of stakeholders from around the state and issued a final report. That was at the beginning of 2025. But Dr. Mahal and Dr. Benini did not stop there. They have pushed for an official designation of Liver Health Day here in Connecticut. And I'm wearing my Liver Health Day pin, and that's thanks to their advocacy. They have spurred on multiple educational events, and yesterday in New Haven convened a really impressive group of what I think was a couple hundred providers, physicians and surgeons and social workers and many others who work to help address liver health in our state. At that event, Senator Anwar really adeptly described the liver and its functions. Again, I wish he was here today to share that. But one of the things that I love that he said is that it is our liver. It's literally what keeps us alive and living. And the liver, which I didn't know, is responsible for 500 vital functions. It's such a complex organ. And my eyes through this working group process, through yesterday's event, and through conversations here at the General Assembly have been absolutely opened. I shared yesterday too, I was shocked to learn that 30 to 40%, and I'll say that again, 30 to 40% of Connecticut residents likely have MASLD, which is metabolic dysfunction associated steatotic liver disease, MASLD, or as you all refer to it, MASLD. As I said, it's difficult even to pronounce, but it is also difficult to really take in the scope of the issue that so many Connecticut residents don't know impacts them. This is something that is not created by alcohol. That's what we think about when we think about liver disease. Most of us who are non-professionals, we think about cirrhosis, but this is something caused by sedentary lifestyle, obesity, underlying genetic factors, and more, and can progress, to what's called MASH, which is more severe. And then the term many of us are more familiar with, or a condition many of us are more familiar with, which is cirrhosis of the liver. The thing that is so scary about this, or so concerning, is that this can happen without symptoms. So people are not aware and they don't know that they can be dealing with this issue. The other thing that was really shocking to learn was that 18 to 39-year-olds, this is where we see the greatest increase. And for me too, learning that our Hispanic family members, friends, and community members are disproportionately impacted and susceptible, that they need to know. We need to go where people are to reach out to help people understand. That's part of why we're here. Yesterday too, at the event, I talked about the fact that we've all heard the familiar refrains of less sugar, more exercise, less carbohydrates, and we think about heart disease. We don't think about liver disease. We're here today to talk about that. In the end, the working group created 20 different recommendations that will require us to work across systems and here at the legislature across committees to address them, including addressing the social determinants of health. Issues like how we build and design communities to allow for exercise, how we address food deserts and the lack of access to healthy, fresh foods, and how we work together to build bridges, build relationships, build coalitions, have these coalitions, and to translate so that the people of Connecticut understand what's at risk and what they can do. Today, I am incredibly honored to have with us an absolutely amazing group who is working to help, who are working to help the people of Connecticut to understand these issues, to treat them, to prevent these issues, and to look at innovative solutions. And I'm going to start with one of our two working group co-chairs, an amazing leader who is also a professor of medicine, the director of the Yale Fatty Liver Disease Program, the medical director at the Yale Center for Weight Management and the Yale School of Medicine, and that is Dr. Raj Mahal. And I welcome you to the podium, and thank you so much for your incredible work. Dr. Mahal.
Thank you, Senator Vahey McCarthy. So welcome, everybody. First of all, I'd just like to point out that what we need to do and what needs to be done will require all of us. So first of all, thank you for first of all being here, but it will require us across physicians, caregivers, academia, pharma, etc. So that's sort of the scope of the work that needs to be done. Last year, we were incredibly successful in actually having April 19th as designated as Liver Health Day in Connecticut, which was, I think, a phenomenal step, which again only happened because of the work of many, many people. And yesterday's meeting was one obvious outcome of that. Looking forward, we had 20 recommendations from the NASH working group about a year ago at this point, a year and a half ago. And two broad areas which I'd like to highlight today. One is simply identification of patients who we know are out there. And this is a huge issue that we know there are people in our community with liver disease, but they have yet not been identified. And the reason for this is, and this is how Senator Anwar very gracefully described it yesterday, is that the liver is a kind and a quiet organ. So it just keeps working, it keeps supporting the body, and it doesn't make any noise until things are far too late. So we know these patients are out there, and there are several ways to identify them. One way would be to actually have a state-level interrogation of medical records, because there's information in the medical records which would allow us to identify these individuals. And the second would actually be active screening. And one of our proposals was to have several of these machines, which are called FibroScan machines, and then a couple of trained individuals who would go through the state at community centers and perhaps things like blood donation centers and actually screen people for liver disease. Currently, it is accepted and recognized that certainly high-risk patients, such as those with type 2 diabetes, should be screened, but implementation has not really happened at this point. So we, first of all, by various ways, we need to go out and identify these people who are quietly, unfortunately, developing progressive liver disease. The second, of course, is educating our community about this, and even medical colleagues probably don't quite realize the severity of the situation. So education for our colleagues in primary care and other areas, but I think most importantly, education of students. So essentially preparing educational materials, perhaps at the state level or perhaps a group outside the state, which could simply be handed to teachers in middle school and at high school, which they could then use. So one day a year as part of their health class, in addition to speaking about smoking and other things that are important, they would actually have material to share with their students. So, those two areas, identifying patients who are out there before their disease becomes too severe, and raising awareness in the community. So thank you.
Thank you so much, Dr. Mahal, for your incredible leadership and the information that you have provided today. Next, I'd like to introduce the other co-chair of the working group, Dr. Bubu Benini, who is Assistant Professor of Medicine, Translational Research Director, Metabolic Health and Weight Management Program at the Yale School of Medicine. Dr. Benini.
Thank you so much. Good morning, and thank you for joining us for this event. This morning, I'd like to focus on institutional collaboration, how we can translate shared concern about liver disease into coordinated statewide action that is measurable, sustainable, and equitable. So we know that liver disease is a complex challenge and touches on prevention, primary care, specialty care, behavioral health, public health surveillance, and community trust. No single institution can address all of those areas. Collaboration is the operating model that will make real progress possible. And in that regard, I would like to thank all the institutions for their efforts and activities as part of this inaugural Connecticut Liver Health Day. I want to mention the West Haven VA Medical Center, St. Mary's Waterbury Trinity Health Hospital, Southern Connecticut State University, University of Connecticut, Yale New Haven Hospital and Yale School of Medicine, and Hartford Healthcare. We hope that in subsequent years, we'll have many, many more institutions taking part in these activities. So what can coordinated, collaborative care in liver health look like across Connecticut? First, alignment around common goals and shared standards. When state and local public health agencies, health systems, and community health centers, as well as academic partners, come together and agree on evidence-based approaches like hepatitis vaccination and cure pathways. This really expands access and streamlines services. People should not have to receive different answers depending on which door they walk through. Second, coordinated pathways from screening to treatment, as Dr. Mihal touched on briefly. We need to build clear referral networks and navigation support so that screening leads to timely confirmation testing and action from there on. Third, shared data and accountability done in a responsible manner. Coordinated action requires us to understand where the burden is highest, where gaps in screening or treatment persist, and whether our interventions are working. Institutions can collaborate by using consistent metrics, reporting progress transparently, and protecting privacy while still learning from statewide patterns. Fourth, centered delivery. This means that we extend beyond our traditional clinical settings through trusted community organizations, mobile outreach, culturally and linguistic appropriate education, and connections to services that influence liver health, including things like nutrition support and substance use treatment. Community partners we know are essential to make this impact. Finally, we need to think about sustainability. We must build durable progress when collaboration with others through payers, employers, and policymakers so that prevention and early detection are supported through this collaborative effort. So Connecticut Liver Health Day marks a starting line, and the commitment we're making today is to work towards institutional connection, keep pathways clear, and involve all partners in this process. Thank you for your partnership and your leadership.
Thank you, Dr. Benini. Next, we're going to hear from Dr. Peter Block, who is Assistant Professor of Medicine, Digestive Diseases at the Yale School of Medicine. Dr. Block.
Good morning, everyone. Thank you all for being here to help us celebrate this inaugural Connecticut Liver Health Day. I am an assistant professor at Yale University, where I care for patients with a wide variety of chronic liver diseases. Today, I want to focus on an important aspect of our efforts, which is patient advocacy and community engagement in everything that we are doing. This is not just a professional priority for me, but also a personal one. I have family members with chronic liver disease who inspired my own journey into medicine and have motivated me to become a real advocate for the broader patient community. So as we embark on ambitious programs and policy initiatives, I want to emphasize a simple but essential principle, and that's that we must engage our patients and their communities early and often so that their values and lived experiences are embedded in our efforts from the very start. This may sound self-evident, but in practice it can be difficult, and in fact it's often overlooked. But elevating the voices of patients and the communities we serve is a foundational component to what we're doing. It's also a practical necessity. Success of any screening initiative or linkage to care program depends on community trust and participation. Without that buy-in, even the best designed and well-meaning programs will fall short of their goals. So that's why investing early in strong academic, community, and legislative partnerships is so critical to what we're doing. These relationships take time, intention, resources, but they are what will turn a good idea into a successful and meaningful impact. And for this reason, our efforts already to put together events like this are really at the benefit or from the benefit of collaborations with key community stakeholders, including the American Liver Foundation and the Liver and Health Innovation Consortium, which itself was created to primarily support events today like the Connecticut Liver Health Day. So as we invest in patient participation and community engagement, we create programs that are built on trust, equity, and lasting change that can and will resonate throughout our state of Connecticut. Thank you for your time.
Thank you, Dr. Vach, for emphasizing the importance of the patient voice. That is absolutely critical. Next, we are going to hear from Dr. Elizabeth Richardson, who is an assistant clinical professor of medicine at the University of Connecticut, a transplant hepatologist at Hartford Health, and a member of the Connecticut State Working Group. Thank you.
Good morning, everybody. Thank you for being here today. It's an honor. I'm Liz Richardson, and I have a liver clinic right down the street here and treat patients in Hartford. And I've been asked to make some comments today about how MASLD is really a cardiometabolic disease, that we're here talking about Connecticut Liver Health Day, but in truth, a lot of these patients have other comorbidities that are recognized as maybe outside of the liver. So high blood pressure, high cholesterol, obesity, and diabetes. And really, one way of thinking about optimizing liver health is to open up to how all of these things are one system and working together. So if our patients with liver disease also happen to have diabetes, and they're being seen probably in an endocrinology clinic, or if they have high cholesterol, there's a good chance they have a heart doctor. And so it's really recognizing this as a systemic issue and then working together as partners in healthcare to bring patients to the best care and the appropriate care at the right time. Again, we're talking about Connecticut Liver Health Day, but the truth of the matter is that some of the complications that patients can see are actually not liver related at all. They can have cardiac issues that can be serious as well. And so I think it's important that we look at the whole patient when we're talking about liver disease, because it's that broad. And then in speaking about subcategories of patients with different comorbidities, for instance, individuals with diabetes. So 30% is a number that we hear a lot this morning, talking about the number of people impacted. But when you look at subpopulations of individuals, such as those with diabetes, that number goes from 30% to 50, sometimes more percent, depending on some of the statistics that you're reading through. So really just recognizing who is at risk in different areas. Thank you so much.
Thank you, Dr. Richardson, for highlighting the reminder of looking at all systems and the whole person. Next today, we will hear from Dr. Hiroshi Sagawa, who is the Surgical Director of Liver Transplantation, Transplant, and Immunology Surgery.
Good morning. Thank you for being here. At the Yale New Haven Hospital and Yale School of Medicine, I have a big privilege to witness transformative life change through the liver transplantation. One message is that transplant is not just saving lives, but also let the patient live long and live well. The biggest challenge what we have is we don't have enough donor organs. And I would like to address 3 different ways to address this. One is first part is innovation. So we use, it is called normothermic machine perfusion, or called NMP, which let the organ to live and function outside of body. That will makes us to doing a liver transplant safely. We able to assess and also improve organ quality even before transplant. The second is by donation, expanding donor pool. We using a little bit older donors or some donor conditions which doesn't allow to once in the past allow to do a transplant. But we're using safely and we using technologies. And this way we don't waste the organs, we save more lives. Three, perhaps more importantly, living donation. And the people will be allowed to donate a piece of a liver, a part of a liver, and donor and recipient can recover with functional liver. Functional liver. Not many patients be aware of a living donor is an option. Fewer organs. This way, we can have more transplant can be done. And particularly, it's important to have a living donor advocate. They educate, they go through how to get to a living donation. That's very important. And today our message is clear. We need awareness. We need donors. We need action. At Yale, we are committed to push the boundaries with passion, compassion, and empathy, and to save more lives and to improve long-term outcome. Thank you.
Thank you so much for that important message that people know that they can be a living donor and the power of the liver. Next, we're going to hear from two different groups who have the two currently approved drugs, the only currently approved drugs to treat MASH. And first, we are going to hear from Anton Wolf Christensen, the Senior Director, Medical and Translation Science, Research and Development at Novo Nordisk. Also, Doctor.
Good morning, everyone, and thank you to the organizing committee for having me here. My name is Anton Wolf Christensen, and I head up the drug development physicians in Novo Nordisk who are working on our cardiovascular and liver disease assets and guiding them through the clinical phases. What strikes me about liver disease, and has also been mentioned here before, is that especially conditions like MASH, they remain invisible for so long time, despite affecting millions of people. Among those living with overweight and obesity, we know that approximately 1 in 3 have MASH, and because the disease is often asymptomatic in the early stages, it remains undiagnosed until it has already progressed, maybe advancing to liver cirrhosis, liver cancer, or perhaps the need for transplantation. Today, that is starting to change. Awareness is growing, driven in large part by scientific progress and a deeper understanding of the disease, which has also led to us being able to detect the disease earlier and also to treat it. So I was asked to talk a little bit about what is the role of the industry at this moment and looking ahead. And it's also been mentioned a couple of times that advancing a therapy area is a collaboration, and I could not agree more with that. I see industry as an integral part of the scientific ecosystem. Our particular strength lies in generating large, rigorous clinical data sets, studying long-term outcomes in diverse populations with rigor and scale that can inform clinical practice, regulators, and health systems about very specific questions, like, for example, does treatment A work in this specific patient population? In MASH, this work has begun to translate into meaningful advances for patients, and in recent years, new therapies for MASH have given patients and clinicians options for treatment. At the same time, we in the industry, we recognize our limitations. We are only one part of this ecosystem. And there are many, many more clinical and scientific questions that are important and need answering. And we're not always the best ones positioned to come with these answers. And some examples could be, we're not always best positioned to unravel disease mechanisms, discover new biomarkers, or study biology at great depth. These are areas where academic centers, such as those represented here today, they excel. And these capabilities are, of course, not competing, they're complementary. And advancing liver science depends on all of these parts of the ecosystem working together, ultimately for the benefit of patients. The fact that we're all gathered here today, legislators, clinicians, academic researchers, and industry, speaks to the strength of this ecosystem. Liver health is entering a new era, sitting squarely at the intersection of public health, clinical care, and science. And now's the time to act, to harness these scientific opportunities and translate them into real public health benefits. And we in Novo Nordisk are certainly committed to doing our part. Thank you.
Thank you so much. And next, and our final speaker today, before we wrap up, is Bill Sibold, the Chief Executive Officer of Madrigal Pharmaceuticals.
Thank you. Well, good morning. And first of all, congratulations to the committee for such a significant effort, and a thanks to the state for acknowledging the importance of the liver. As you've heard, it is a vital organ, underappreciated. I often call it the most underappreciated organ. So I'm happy to see Connecticut take this really important step. You know, MASH, as you've heard, is a very serious liver disease that can lead to cirrhosis, liver failure, liver cancer, need for liver transplantation, and premature death. It's the leading cause of liver transplants for women in America, and number 2 overall for liver transplants in the United States. My company, Madrigal, developed the first FDA-approved medication for MASH called Rezdiffra. Prior to Rezdiffra's approval in 2024, more than 20 investigational medications failed in clinical studies, including medications from some of the biggest companies in our industry. MASH became known as the graveyard for drug development, and research investment was drying up. But our small team from West Conshohocken, Pennsylvania, finally broke through with an innovative medication for MASH that reduced liver fat, inflammation, and severe liver scarring that leads to cirrhosis. There were fewer than 5 employees at Madrigal when our founder, Dr. Becky Taub, started the company in 2008. And after 18 years and $3 billion of investment, today we have more than 1,000 employees, and Rezdiffra is being used in tens of thousands of patients. And importantly, our success has catalyzed a surge of new industry investment in MASH research, including our own. There are now more than 75 MASH therapies from about 70 different companies that are in development. And in just the last year, Madrigal alone has added more than 10 investigational medications to our MASH pipeline. Somebody makes a breakthrough and others follow and drive the innovation further. That is really the great part of what we're doing here. And we won't stop innovating because every team member at Madrigal is dedicated to our company purpose, to lead the fight against MASH. I believe Becky's story and Madrigal's story represent the best of what our industry is capable of. This is a hopeful time for patients with MASH and other serious liver disease, but we are also clear-eyed about the challenges facing the community. There is an urgent need to improve awareness, testing, and patient access to treatment. We also need to ensure that public policy creates an environment where innovation can continue to grow and accelerate. That is why today's event is so important. No single stakeholder can overcome the challenges or achieve the possibilities of innovation. We must work together as we all play an important role. On behalf of all my colleagues at Madrigal, thank you for the opportunity to be here today. And once again, congratulations on Connecticut Liver Health Day. Thank you.
Thank you so much. And as a person who grew up outside Philly, the Conchi roots are fun to hear about. for those of you who know the Philadelphia area. We have heard today from a group of experts, and why we're here is to tell all of the residents who are not experts, but who are experts in their own bodies, to understand and be aware of what is at risk here when it comes to liver health. And though our working group focused on the issues around MASLD, I would be remiss if we did not, as we did yesterday, also speak about the role of alcohol in liver disease as well. And that's something, again, that many of us are already aware of. But we see increasing use of alcohol, particularly among women. And as I shared yesterday, I think a lot of people would be surprised to know that 4 drinks for a woman and 5 drinks for a man in one setting is considered binge drinking. And I think a lot of people aren't very comfortable with that label for perhaps their Super Bowl party or their backyard barbecue. But it's also something that we need to be aware of, and certainly that these professionals behind me are very well aware of. So I cannot say thank you enough to all of you who are gathered here, both behind me and in front of me, for the work that you are doing to help prevent disease and save lives, to treat patients, to advocate for patients, and to bring together the systems that are needed to collaboratively provide solutions.